Okay, let's talk about stem cell therapy for male stress urinary incontinence. So, again, stress urinary incontinence is the type of incontinence that happens when there's an increase in abdominal pressure from things like coughing, sneezing, laughing, picking something up, or bending down, where the abdominal pressure causes the fluid to come out through the sphincter. Now, this is usually happening after somebody's had some type of prostate procedure, either had their prostate entirely removed for cancer or had a procedure to open up a channel in the prostate to help them urinate better. This is the type of incontinence that I'm talking about, which is different from the urge incontinence, which is you got an urge to go to the bathroom, and if you don't get there quickly enough, you leak a little bit. That's a totally different disease that has totally different treatment options. So for here, we're talking about just stress incontinence, and I'm just going to be talking about male stress incontinence. Female stress incontinence is a lot more common, but that's not really my area of expertise, so I'll leave that to somebody else. In male incontinence, the thought is that there was damage to the sphincter. And so we try to do things to help improve the strength of the external urinary sphincter, which is really your pelvic floor muscles. So the first line of treatment is Kegel exercises, or exercises that are thought to strengthen the pelvic floor muscles. And these have been shown to be very effective, but only for the first year after the prostate surgery. After a year, you're unlikely to get any added benefit from more Kegel exercises. So at that point, in the current practice of urology in this country, the options are basically surgical, where you have either a sling or an artificial sphincter surgically implanted to essentially restore the sphincter function. We don't currently have anything that actually regenerates or restores the natural sphincter function that you have. And that's sort of the hope or the goal from stem cell therapy, that you could inject something into the sphincter that helps to restore that function. So the most common one that people have looked into is skeletal muscle stem cells, because the external urinary sphincter is a skeletal muscle itself. So you can basically take a biopsy of somebody's muscle and then separate the stem cells from the remaining cells, which requires some cell culture work, but it's not that complicated. And then take those muscle stem cells and then inject them into the urinary sphincter through a minimally invasive approach using a camera up the urethra or the pee hole, using a camera up the pee hole, using a needle that goes through the camera to inject it directly into the muscle and deliver those stem cells directly to the target. Now, in theory, this really should work because these stem cells secrete factors that help to regenerate and restore the muscle strength and the nerves there. Now, there are some animal studies that have shown that this have worked, but the human studies are limited. Uh, there are some preliminary data in some men that show that there might be some benefit, but it definitely has not been a home run by any stretch. Now, part of the question is, what's the best way to do this? What's the concentration of stem cells that needs to be used, and how many different treatments need to be done? Right? Is this just a one and done, you're cured, or you have to come back every month to get a repeat injection? How many rounds of injections do you need? Is it really skeletal muscle that's the best one to be using in this situation, or should we be using adipose stem cells, which are also very easy to harvest, that may be more effective in this situation? So there's a lot of questions that have not been answered, and there's definitely no good clinical data that really shows that this works. There are some very smart people that are working on this and are soon going to start enrolling more patients for clinical trials to look into this. But until then, it's really only in the experimental world. And I would very strongly caution anybody from really considering any of these regenerative or stem cell treatment options for stress incontinence outside of the context of a clinical trial. So if you get tagged with some advertisement of some clinic that's doing this, I would I would not go for it, because one, they're basically just doing a cash only operation regardless of the outcome. They're going to take your cash. And two, they haven't really gone through the legwork of getting approval for a clinical trial. it takes a lot of work. You have to have an ethics committee review your proposal and agree that what you're doing is ethical and reasonable. You also have to have a lot of money to do a clinical trial. So it can't just be some backyard operation. It's generally professors associated with the university that are doing this thing the right way. So if you're really interested in this, I would encourage you to look for a clinical trial. You can look them up on clinicaltrials.gov or talk to your urologist about it and enroll in a trial, have it done the right way, and have the results of your experience published in the scientific literature, move the field forward. But I definitely wouldn't do it in the absence of a clinical trial. Uh, if you're not interested in being sort of part of an experimental protocol, at this point, I would say talk with your urologist about some of the standard treatment options like slings or sphincters that have been around for decades and have been very well studied and are in the urology guidelines.